Hello everyone and welcome to Ask a Member. This is Ann Hughes, President of the Adrian Area Chamber of Commerce, with Dr. Rashawn Venerable with TLC Eyecare, both here in Lenawee County and numerous other locations as well. Welcome.
Thank you very much. Nice to be here.
So how long have you been with TLC?
I've been with TLC at the beginning of this year, 2012.
Okay. And did you bring new skills and services with you that weren't available before?
I think I've certainly expanded on a lot of the services that are offered at TLC, including plastic surgery, more ophthalmology, eye care, plastic surgery in the sense of Botox injections, as well as facial fillers, collagen injections, and eyelid lifts, and brow and forehead lifts.
Okay, I never thought, and you and I talked a little bit ago too, I never put, ophthalmology and plastic surgery in the same practice before until we had that conversation.
Yes, there is actually a specialized niche in ophthalmology, ophthalmic plastics, and that's kind of where my focus is.
So what procedures do you do most?
At this time, it's mostly upper eyelid lifts, so the excess skin above the eyelids.
Okay, and that's, I understand that's plastic surgery, but that's also, that changes people's vision.
It absolutely does.
I have a couple friends who had that done, and they said it was just like coming up from under the clouds.
Exactly, and that's one of the reasons why that procedure is actually covered by most insurances. Because it does impair the vision. So it's a lot of options for you as far as both for improving your vision as well as the looks.
Well, I take it then that some of the other things that you do, the other services, aren't necessarily covered.
They may not be. Things like brow lifts may actually be covered if it's allowing extra skin to be in the visual axis. Things like the Botox, if it's for cosmetic purposes, are not covered, but if it's for functional purposes like blepharospasm, which is twitching of the eyes or facial structures, it can be covered.
And you can stop those twitches with Botox?
Absolutely. Usually we like to try other conservative means first, but Botox is very effective, and the effects last for months on to even years later.
Now, do you do other surgical procedures on the eyes as well?
I do. I also do a range of general ophthalmic surgery, both from cataracts to glaucoma surgery, lasers, treating glaucoma, diabetes, as well as post-cataract care.
Do you do all that in the office here in Adrian?
Most of the things we can do in the office. There are a few things that we have to do at the hospital. Mostly the things like cataract and glaucoma surgery itself.
Okay. And cataract surgery has changed so in the last, I don't know how many years, but I can remember, I had a great aunt who had cataract surgery and she had to lay still and they put sandbags on either side of her head. And,
yes.
And now people have it done and they go back to their normal life, and the next week they go back and get the second one done, and they're all set.
It's really a revolutionary procedure nowadays. It usually only takes about 10 minutes of actual surgical time. Unfortunately, you can be in the hospital for a couple of hours to get all the paperwork. If you do it at a surgical center, it's a little faster, about 45 minutes. Get you in, get you out. There's no pain associated with it. And the recovery time is almost overnight.
That's amazing. Now, do you work out of a hospital for some of those procedures, or does TLC have its own surgical center?
A little bit of both, actually. A lot of our patients here in the area really appreciate going somewhere local, like we do surgeries at Tecumseh Hospital, Eric. TLC does have a surgical center that we are affiliated with, both in Jackson, Michigan, Lakewood, as well as Regency in Ohio.
Okay. Now, you mentioned some other offices, Regency in Ohio, Lakewood and Jackson. How many offices does TLC have?
TLC has approximately 20 offices, growing almost yearly, certainly, and 12 12 locations, over 20 doctors, and expanding its physicians yearly, and as well as our practices and offices.
Now, do you spend most of your time here in Adrian?
Most of my time is spent here in Adrian, yes.
Okay.
There's certainly a need for more physicians here. The population is getting a little, it is getting older, and so their eye care is becoming more prominent and needed.
Okay. Now the population aging, the baby boomers reaching Medicare age and above, that certainly provides the medical field with some opportunity.
Absolutely. And Little Way is a great area to retire. It's very,
Now, and you're obviously a long way from retirement. You just got here. But we were talking, you live in Brenton.
Yes.
Why did you choose to live in Illinois County?
I felt that it was a very wholesome community that I wanted to raise my family in. It's very laid back per se, and everyone's very friendly here. So I thought it was a very great fit for us.
Well, that's good. We have a program called Living in Lenawee where we're trying to encourage professionals and local executives to make Lenawee County their home instead of living in Ann Arbor or Saline or Sylvania or Toledo. So you're just a perfect example of what we're trying to do.
Great.
What's your favorite part about your job?
To be honest, I would say just trying to find a way to help somebody when they're in need, I think. Being able to accomplish something for them that they get immediate relief and immediate satisfaction is kind of one of the reasons why I chose ophthalmology. There's a lot of different things you can do, from just giving them an eye drop to actually doing a surgery to correct their problem within 24 to 48 hours. And there's a lot of need and a lot of help that we can provide for them.
That's good. I never thought of that. It's almost instant gratification.
Yes, it certainly can be.
What are some of the other services that TLC offers?
We also offer a lot of premium IOLs, or premium intraocular lenses for cataract surgery. The premium services will allow you to be able to see both for distance and near, as well as using more high-tech instruments to accomplish this. And one of those is the Linux laser that we have in Jackson, Michigan. It provides it actually does half of the cataract job for us as far as making our incisions, breaking up the cataract, as well as if there's any type of astigmatism, it can also lay lines in the cornea to kind of correct for that as well. So it gives us a more accurate, more precise surgery.
Is it robotic?
It's not exactly robotic, but it is a computer guided procedure.
Okay. Okay. What's the number one reason somebody should call TLC and make an appointment?
To be honest, I would say quality. I mean, we definitely strive to provide quality eye care and in a more efficient and responsible way, I think.
Okay, very good. What's the best way for them to contact you?
Our number is 1-877 TLC time.
Okay, 1-800-777
Just 1-877
TLC time. Okay,
Yes.
that's better. Okay, Dr. Venerable, thank you very much for coming
It's a
today.
pleasure being here.
Thank you.